diseases are by far the leading cause of mortality, more than AIDS. The World Health Organization says these diseases represent over 60% of deaths, killing more than 36 million people each year worldwide. Examples of non-communicable diseases or lifestyle diseases include strokes, cancers, diabetes, and heart-related illnesses. Meanwhile, local and international experts are currently gathering in Johannesburg to find ways to minimize these health conditions. To tell us more, we joined in studio by Professor Daya Reddy, who is the president of the Academy of Science of South Africa. Professor, good to have you. Welcome to Morning Live.
Good morning. Good to be here.
I've pretty much skimmed the surface of non-communicable diseases. Perhaps I'll leave it to you to explain it a little bit more in depth.
Yes, well, briefly, one would want to distinguish between infectious diseases, and we're aware of HIV/AIDS and tuberculosis, for example, on the one hand, and non-communicable diseases, such as the examples you gave earlier, various cancers, cardiovascular disease, heart disease in particular, diabetes, and the like. And of course, we've given, quite rightly, an enormous amount of attention to infectious diseases in this country and globally as well, but less so to non-communicable diseases, or NCDs as we call them.
Okay. Now let's bring HIV/AIDS into the picture now. And I mean, here in South Africa, is that still the leading cause of death?
It is still the leading cause. That's right. Globally, as you indicated, the NCDs are the leading cause of mortality. But if we take South Africa, it's still HIV/AIDS. However, the NCDs are catching up, if I may put it that way. As people's lifestyles change, we have greater urbanization, adaptation to urban lifestyles with the ills that go along with that, if one thinks about changes in diet, exercise, or lack of exercise, and so on. And so the trend is definitely upward.
Well, I mean, one can understand that, especially. I think it was, when was it, last week, that the nutrition survey that was released here in South Africa. Again, just, I suppose, emphasizing what you are saying, and that our lifestyles are not good, our eating habits are not good. We're talking about obesity in children. This is not boding well for non-communicable diseases.
Absolutely, yes. And that is exactly what the objective of the conference is, to discuss and to explore exactly what the evolution is like. This is globally, because we have representatives from over 70 countries at the conference, what the evolution, what the changes are that are taking place, and of course what to do about it. So ultimately, towards the end of the conference, the objective is to draft a statement that we will then be sending to relevant ministers, other people in government, and the like.
If we have to draw a comparison between HIV, which we do know is the biggest killer here in South Africa, and non-communicable diseases, what's it looking like? Is this catching up to the rate of death?
Well, I don't know the statistics offhand, but I would say that as we continue to combat HIV and AIDS, and can look forward to a decline in mortality rates, one would expect that unless we do something about it, the NCDs are going to catch up and could, in principle, exceed the numbers of deaths that we have due to HIV/AIDS.
Is there not enough education within society about non-communicable diseases, that this is one of the biggest killers in the world?
Yes, well, I think that in a sense there never is enough education. One can never do enough to educate people at all levels, whether it's schools, in the workplace, through the various media, about, first of all, what they are, the sinister nature of NCDs, in that by and large they are generally symptomless killer diseases, silent killers, as people refer to heart disease, for example. Educating people about those, and then also about the link between lifestyle, for example, and NCDs. So that, I think, we have to continue to pursue vigorously.
And all lifestyle related, no doubt. 16th of this month, the conference is starting. That's Friday. Very quickly, who is in attendance? Do you have government representatives?
Well, we're actually starting today.
Oh, I beg your pardon, it's today.
That's right.
Okay, I have the 16th. So it starts today, when does it end?
Yeah, well, we'll go through until the 16th. It's actually a conference.
So it ends on the 16th, yeah.
And then we also have the General Assembly. So the conference is that of the IAMP, which is the Inter-Academy Medical Panel. It's a network of 70 medical academies from around the world.
Yeah.
So if I could just momentarily digress and indicate that academies of science are generally bodies that, of course, honour outstanding scientists and the like, but they're not simply a club. They exist to provide scientifically based policy advice to government and the public generally. So that's the context in which this conference is taking place.
Yeah.
We have a number of international speakers. We have the Director General from the Department of Health who will be joining us and delivering a keynote address this morning as well.
All right, fantastic. We wish you all the best. Professor Daya Reddy, President of the Academy of Science SA, chatting to us about non-communicable diseases. Lifestyle. We keep talking about that. All right, let's get you